today we're going to be joined by two leaders making major moves in psychedelic research in Canada. Dr. Ron Shore and Dr. Harriet Richardson, who recently secured a massive grant from the Canadian Cancer Society and Brain Canada, are launching what they call CAN-PACT, which is a national collaborative that's aiming to transform mental health support in cancer care. The Center for Psychedelics Health and Research is very excited to be affiliated with this project, including our director, Dr. Claudio Suarez. And yeah, so it seems like there's really a need for a more sort of comprehensive method or approach to help with mental health and cancer care. And I guess that's where psychedelic-assisted cancer therapy comes in. So I would love for you to speak a little bit about, I'm going to combine a few of my questions here, but what is psychedelic-assisted cancer therapy? What is the evidence for its utility in cancer care, if that's even been looked at yet? And your thoughts on mechanism. So how is this exactly helping patients in cancer care?
I've said a couple times when we're talking about CAN-PACT is I'm really, really pleased that the single largest kind of investment in psychedelic research is occurring within cancer care for a number of reasons. And one of those reasons is it's kind of where it began to some degree. Like you can kind of go back and where did psychedelics start, and we can go back into ancient history and traditional history, indigenous cultures, and that's certainly one track we need to understand the anthropology of these meaningful rituals using psychoactive plants for either social bonding or culturation, learning about cosmology. But traditionally they were used to heal. And they were used to heal physically and emotionally and spiritually as well. So in the Western model, we're not really used to talking about drugs to create an experience of mysticism or connectivity. So psychedelics introduces a bit of a new discourse into Western science and Western medicine.
I guess some of the questions are, what is the extent to which the therapy that you have supporting that sort of a macro dose of psilocybin is important versus just the macro dose of psilocybin alone. And, some of these trials have looked at that. They've tried to sort of compare, a macro dose of psilocybin with assisted support, assisted therapy guiding you through your experience versus maybe somebody on an active placebo, but having sort of similar therapy and support. And in general, it seems that it's the combination of the macro dose of psilocybin with that assisted therapy above and beyond just that therapy alone, which is, I think, what's kind of really caught people's attention.